Research Roundup, where we discuss ideas and opinions about current research and evidence that informs our practice. My name is Jared Bryan, and today we're going to talk about JOSPT Viewpoint from June, titled Many Paths to Recovery, The Case for Treatment Pluralism by Jared Powell, Amy McDevitt, and Chad Cook. When I first read it, I was excited because it really syncs up with my thoughts and opinions about manual therapy and exercise. Having practiced for 23 years, I recognize many of the topics and considerations that the viewpoint expresses is that patients respond differently to different interventions. This viewpoint discusses what pluralism is. It discusses mechanisms and shared mechanisms, and it tries to bring some consensus to the current thought around that there is no single best intervention, but that many interventions may be helpful to each unique different patient. One of the first things that I took away from this is my thought process around the Mulligan concept and how it relates to this. In the Mulligan concept, we know that we're looking for responders, immediate change to joint mobilization and an improved function or an improved range of motion. And we often see that within 2 or 3 minutes of providing the mobilization with movement. Now, my training and my teaching of the Mulligan concept very much is in line with this current view that if we're not achieving the desired result of improved range of motion or improved function within 2 or 3 minutes, we're going to move on and explore other options. Ultimately, the idea of treatment pluralism revolves around clinical reasoning. Clinical reasoning is a vital part of what we do in our profession. And when you come to a Mulligan concept course, you're going to get a lot of clinical reasoning. And it's going to help with this idea of what we're talking about in this viewpoint. So let's talk about pluralism, treatment pluralism. What is it? I'm just going to read what it says. In place of a universal best treatment, treatment pluralism recognizes that there are many valid paths to recovery, drawing from a bounded range of safe, plausible, and evidence-informed approaches shaped by patient goals, values, preferences, clinical context, and expertise. For a long time, there's been these battles between what's better, and we see these extremes of exercise only or strong opinions about manual therapy, when reality, in the cases that we see in the clinic, people respond to a variety of treatments, maybe for the same mechanism, maybe because of their preferences. But this idea of treatment pluralism is that we have to be open and honest about what's working with each individual patient. And we circle back to the Mulligan concept. It's exactly what we do each and every time that we apply the Mulligan concept, or specifically mobilization with movement. We're looking for an immediate change. So it's a clinical assessment, and that assessment then turns into the treatment. Take a look at the viewpoint, read about it, see what you think, and then consider how that might fit into taking a Mulligan concept course. When you come to a Mulligan concept course, what you'll notice is it's superior to any online educational content that you can get. While there is value in that, to become proficient with your hands and to improve your manual therapy skills, you have to show up to a live course. I look forward to seeing you at one of our courses soon. Thanks for listening. Until next time, we'll see you later.